Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, diagnosis of hydatid cyst. So, if you see diagnosis of a hydatid cyst, first we should find the where the hydatid cyst is present. So, for that we do an ultrasonography and CT scan are important modalities for the diagnosis of the hydatid cyst. Then, how do you what are suggestive features of hydatid cyst? If you see presence of in the ultrasonography or CT scan, you will see presence of daughter cyst is seen with a large cyst. There will be large cyst with small daughter cyst which are present. So this rosette like appearance is seen along with calcification. Then this will suggest that it is a hydatid cyst. Then, once you have seen this on ultrasonography and CT scan, then for confirmation of diagnosis, you should do a serological test. The serological test is by antibody test, other tests which are done for confirmation of the hydatid cyst. So, what serological tests do? You can do an ELISA can be done has a serological test or immunoblot for antibodies or for ARC5 or immunohemochromato IHA where immunohemagglutination assay indirect hemagglutination assay can also be done for the confirmation of serological test. That is, you can do ELISA, enzyme linked immunosorbent assay, immunoblot, ARC5, and indirect hemagglutination assay can be done for finding out antibiotics. Okay. If you suspect that there is biliary tract involvement, as already said in the previous lecture, the most common complication is rupture into the biliary tree. If you suspect that there is a rupture into the biliary tree when the patient presents with jaundice, then the gold standard investigation in such cases is ERCP is done as gold standardly, or sometimes you can even do a percutaneous cholangiography can be done in some cases.
thank you and thank you for watching.